Duet lens implant surgery is a really interesting and very lovely concept for certain patients who want multifocality, but for whom a primary multifocal lens to replace the natural lens of the eye is perhaps not an ideal first choice for them. That may be because they're not quite sure whether they would be able to tolerate the small chance of experiencing halos or glare from light sources after the surgery, or if there may be a possible family history of a medical condition that they have not had manifest in the eye to this point in time, but which may become manifest in the future. And if that medical condition had been present at the initial consultation, would possibly have precluded them from having a multifocal lens implant operation. So an example might be glaucoma. If a patient has glaucoma, then it would not be a good idea to use a multifocal lens implant to replace a cataract. But if a patient does not have glaucoma, but perhaps has a family history, or even without that, is concerned about what may happen to the eye in the future, and they want the reversibility of a multifocal lens, but without the significant risks involved in exchanging a primary lens, then a Duet operation would be something that's worth considering. And a Duet operation works where we use a monofocal lens implant to replace the cataract or the natural lens of the eye if it's a refractive lens exchange operation. So a monofocal lens looks like this with the same power all the way across the lens. So that lens will be implanted where the natural lens of the eye was initially located and from where it's been removed. And that would be supported by the transparent skin, the capsular bag that supports the natural lens of the eye. The multifocality then comes from a piggyback lens with the multifocal zones. And a piggyback lens is specifically designed to sit in front of the lens capsule in an area called the sulcus. And so the piggyback lens is implanted just in front of the first lens at the same operation as having had the cataract surgery or the refractive lens exchange operation, so that when light comes into the eye, it goes through the multifocal lens and the monofocal lens to focus on the retina. So the patient achieves multifocality, but if something were to happen in the future, which meant it would be a good idea that this particular eye was not multifocal, the multifocal lens could be removed in a procedure which is significantly less involved with significantly less risks than would have been the case in exchanging a multifocal lens from within the capsular bag. And so Duet surgery is a very nice option for people who are unsure whether a primary multifocal lens would be a good idea for them, or where I feel that there's a slight doubt as to the suitability of a primary multifocal lens. I invite you to book a consultation in order to determine your suitability for refractive cataract surgery or refractive lens exchange. It's the only way to determine your suitability for these procedures and to have an in-depth discussion regarding the risks and benefits of each of them. I look forward to seeing you there and taking you through the journey to achieving your desired post-operative outcome.